Hey, it's Adam Weinfeld. We're going to be doing a lunch and learn today, and I am going to be talking about breast surgery. That's right, Adam Weinfeld talking about breast surgery. I say that only because I think you guys know me more for talking about surgery of the face, although I actually do a lot of breast surgery, and right now we're going to be talking about cosmetic breast surgery. I want to introduce something to this conversation. It's a white box, relatively boring, isn't it? But inside there's really, and I was holding it upside down. Here's the white box. You may not be able to see this, but let me tell you, inside of this really boring white box, there's something really exciting, and that's Galaflex. Galaflex is an absorbable mesh that we use to help us perform really predictable cosmetic breast surgery. So when I talk about cosmetic breast surgery and the utilization of this, I'm really speaking mostly about the use of this absorbable mesh in the context of breast implant cosmetic surgery. So when we're using breast implants, we're placing them underneath the breast tissues. And there are some situations in which it's really helpful to have an absorbable mesh. We use the absorbable mesh in order to create support for an implant that might otherwise weigh down in the tissues and relocate to a position that is less aesthetic, less attractive. Now, the situations in which that particular phenomenon is more common is in revisionary breast surgery. Now, that's not to say that Galaflex does not have a role in primary breast augmentation, but I'm not going to be talking about that today. I'm going to be talking about Galaflex as it is used in revisionary breast surgery. So, in revisionary breast surgery with implants, we're often seeing patients who have a situation in which the implant is located a little bit too low, a little bit to the side, or even a little bit too far to the center. In that condition where both implants are too far to the center, we call it synmastia. If the implant is a little bit too low, we call it bottoming out. Or even pseudotosis of a breast implant. And then if the breasts are too far to the side, I don't know what the name of that is, but many women don't like it, and that makes a lot of sense because it's certainly an older look. It's a look where it demonstrates that the tissues have been stretched out. Many women want their breast implants to be located higher and more centrally without being too close together. So, if a woman has had a breast augmentation and the pocket on the inside has stretched out, we need to create a tighter pocket, a more well-defined, a more deliberate pocket. And the way we go about that is we perform a surgery where we remove the implant. And then we have to address the pocket which is located on the inside, and we call the inner surface of that pocket a capsule. And what we need to do is we need to reconfigure the internal 3 dimensions of that capsule, the breast envelope itself. So let's say, for example, the implant that or the breast that we are trying to address in a woman has an implant that's too low or too far to the side. What we would need to do is remove the implant, and then we need to limit the space. We need to lock down that aspect to the outside, laterally, and inferiorly. In the past, we really didn't have a lot of really good ways to do that. What we could do is we could suture together some of the capsule, we could lift up and relocate some of the capsule, but what happened more often than not, those efforts to reposition, limit the dimensions of the capsule inferiorly, lower, and then laterally, those efforts were limited because with those sutures, the tissue would stretch out. But now we have the ability to use an absorbable mesh to supplement, to complement those efforts of the sutures. Let me show you what the mesh is like. So here's the mesh. It has a top and a bottom, although that does not have to dictate or force the way we use it. And what we would do in the breast pocket is that, as I said, we would place some sutures in order to tighten down that space. And then we may even use some heat energy with the cautery to further shrink that space. And then right where those tissues came together, where the sutures came together and there's a seam, we would put the Galaflex and suture it in place, and that would help reinforce that seam that is narrowing that space. and then we'd place our implant back in. And when I say back in, we'd almost always be using a new implant. And in fact, in some women, they want to have a slightly smaller implant, that would be okay, or even a bigger implant or the same size implant. So Galaflex, an absorbable mesh to help reinforce seams that we use inside the breast space to create a better position for the implant.